Hi, I'm Justin Varney. I'm the Director of Public Health for Birmingham City Council, and we wanted to share with you a short presentation to provide a bit of background and a bit of context to the tender for the BLACHIR engagement partners in Birmingham. So I'm going to try and share my screen with you now and take you through a short presentation to give you a bit more information about the approach. And hopefully you'll be able to see the slides now and hear me talk through them. So first of all, it's useful to understand the context of the BLACHIR review. So BLACHIR stands for the Birmingham, Lewisham, African and Caribbean Health Inequalities Review. It's a partnership we launched in 2020, just before the pandemic started. And it was a partnership between two areas to better explore and understand the inequalities affecting African and Caribbean communities in our areas, but really to focus on what do we need to do differently, what does the evidence say we should do differently, but also what do people's lived experiences say we should do differently to break the structural inequalities that are leading to worse health outcomes for African and Caribbean people in our area. The review is a new approach. We worked together with an academic advisory board and an external community advisory board and the public health teams working together, and they took a thematic approach to considering the evidence and the topics. The reason we work together between Lewisham and Birmingham is in Birmingham, although our African and Caribbean community is not our largest non-white British ethnic community, it is the largest population of African and Caribbean people in any one local authority in the country, with over 96,000 citizens who identify with African or Caribbean heritage. In Lewisham, the African and Caribbean community is the largest non-white British ethnic community, but overall the total number of people in Lewisham is smaller, and therefore the numbers are smaller. So that's why we ended up working together. We already were part of a network working on chartered obesity, and BLACHIR really came out of that connection between our two public health departments who said, you know what, we should really try and have a different conversation about this. So we took a thematic approach, and this was where we chose to work through both life course topics, but also topics that are identified in the Marmot review and in the majority of public health literature around key areas for action and key areas for understanding. So we looked at the role of racism and discrimination. We talked about maternity in early years. We also talked about physical health conditions like diabetes and preventable causes of death. Each theme went through a rapid evidence review, either done by the public health team or commissioned out from an academic unit. We then took the evidence review, the literature, to the academic board, who came out with some evidence-based recommendations. Both the evidence papers and the recommendations from the academic board were taken to the community advisory board, who reflected on these in the context of their lived experience and really the practical application side. Was it going to work? And if it had been tried before, why hadn't it worked? We then did a public consultation, so we took those recommendations out into public forums to hear feedback, particularly some workshops with young people. And at the end of all of this, we published the review through the Health and Wellbeing Board on the 31st of January, and the final report will be published with all of the beautiful pictures and the fully accessible version in Birmingham on the 9th of June this year. The review set out 7 core themes for action, but also 39 detailed opportunities. And those 39 detailed opportunities talk about what do we need to do in specific services, who needs to take action. And I'm really pleased that both the NHS and the council have received the report and fully accepted the need to take action and to work through those 39 opportunities. And that's where we are now, moving from the point of view of having done the review into what I see initially as a 2-year programme of implementation. And that's what this tender is about, the engagement partners to work with us on that. We also recognise that there are a whole load of research questions that were missing, that when we looked for data, it wasn't there. And that's a key part of this as well, as we go forward, how we build the evidence base, so that in the future, we don't just go, there's a problem, but we can also talk with some confidence about what needs to happen to fix it. So when we think of the next steps, we are, as Birmingham's public health team, looking to commission 4 engagement partners to work with us in terms of the implementation programme. The partners are focused on 4 communities. Now, you can apply for more than one lot. That means you can be the same organisation delivering engagement with more than one of these 4 communities. But through the review, we heard really loudly and clearly that it was important for us to explore better in more detail the African community engagement separately from the Caribbean community engagement. And there is some debate about people who feel that Black as an overarching term does or doesn't encompass them and their identity. So that's why there are 2 different group lots for African and Caribbean communities. The other thing we heard really loudly is that we needed to be we need to create spaces for engagement and voice and co-production with young people from African and Caribbean communities. And we need to recognise that although there are some crossover areas for young men and women, there are also spaces in which there are different challenges, different narratives, both within communities and about them. And that's why there are 2 age-specific lots, one to work with young African and Caribbean males and one to work with young African and Caribbean females. The engagement partners will be working with us as part of the BLACHIR implementation board to take forward the implementation plan, to co-develop it, and to help us move forward from a report that says things need to change to making them change. The vision for the engagement partners is that they will have several roles. One is they'll form a conduit between the implementation board and the communities to make sure the communities are cited, are engaging with and helping to fuel and inform how we move things forward, and holding us to account, which is really important. The second is we'd like to see the engagement partners help us bring more people to the table, help create opportunities for development and leadership opportunities within the community to help work with us on moving forward the actions. Most of the hard work in terms of making those 39 recommendations become real will not happen at the implementation board. There'll be subgroups, there'll be task and finish groups, there'll be different bits of the system bringing together the right people to make the change happen. And we want to make sure that citizens from the community for whom this is supposed to make an impact are part of those groups. So part of the role of the providers will helping to support and enable that kind of participation in some of the delivery partnerships that really turn the recommendations into reality. I think the third element of the engagement partners is that important element of helping us navigate communities. Many of us in the public health team don't come from the African or Caribbean community, and although we may have family and personal connections, it's not the same as living in that community. Through the review, we've really learned to recognise and understand that even African and Caribbean as terms do not really bring to life the diversity and the vibrancy and the variation within communities, and that there are real differences between the needs and the beliefs and the culture and the behaviours of people who come from South Africa, for example, compared to people who come from Ghana, compared to people who come from Egypt. Yet they are all part of the African continent. And so we need to unpack that, and we hope that the engagement partners will help us work through that as we move forward in the journey. So I think it's a really exciting opportunity for organisations to work with us. I hope it's a development journey, because this is the first time I think the council and any council in the country has done this type of co-produced approach to reflecting on the challenges facing a specific ethnic community in this in-depth way. And as we move forward in the implementation process, it will be a learning journey. There isn't a perfect cookie cutter, this is the way to do it. So we're really hoping that the people that come forward for this tender are open to working with us in a collaborative way, that see this as an opportunity to really undo and change the future for Birmingham. And if we change the future for African and Caribbean people in Birmingham, we will have a big impact across the country. So I think it's a fantastic opportunity, and I hope that you will look at the tender with interest. And I hope it will resonate with you and excite you about the potential here, because I think there are lots of things that we can do. And that's one of the reasons that the spec isn't highly prescriptive in going, you must talk to X number of people a month, or you must do it this way, you do it that way. We're looking for partners who can give us a strong sense of confidence that they understand the community that they are bidding for to support, that they have some existing networks, but they also have some ideas that they want to bring to the table about how to make this a meaningful co-production journey and one that resonates with the wider community. So please bring your ideas, please bring your challenge, please bring your energy, because we really want this to succeed. If you have any questions about the tender opportunity or any further questions about BLACHIR, then please do email in the slide, cps@birmingham.gov.uk. Because this is a tender opportunity, when you ask a question, we do put the question up on the website and we provide the answer on the website, and that gives everyone the opportunity to learn. There are no dumb questions. It is a really good opportunity to ask questions if you have them, so please do use it, and we do try to turn around the answers relatively quickly. But I hope this video is giving you more of a sense of the ambition and our passion for what we're trying to achieve, so that it will help give you confidence, I think, in terms of applying for the tender. For me, BLACHIR is a really exciting project. I've really enjoyed the last 2 years working through this. It's been a bit of a respite from COVID in a sense, but it's something that we've remained committed to delivering as a council and as a partnership despite the pressure of COVID on the public health teams, both here and in Lewisham. And we're now in a phase where we can move from looking at the evidence and saying what needs to change to go, these things need to change, now let's make them happen. And the engagement partners are a really important part of making sure that change does happen. So I hope you'll want to join us with the journey, and I hope you will put in a bid against this tender opportunity. And I look forward to seeing your applications. Thank you very much for your time, and I hope this has been a helpful session for you.